Hello, everyone, and good morning, good afternoon, good noontime to you, depending on where you are in the country. And welcome to the Domestic Violence and Housing Technical Assistance Consortium COVID-19 Special Topic Series on Sexual Violence in Housing during COVID. My name is Carla Bierteller, and I work for the National Sexual Violence Resource Center. And also moderating with me today is Chris Bilhart and Debbie Fox. And our presenters today will be Kat Fribley from the Iowa Coalition Against Sexual Assault, Rebecca Moses from GBV Consulting, and Condencia Braid from the National Association of Sisters of Color Ending Sexual Assault. Welcome, we're so happy that you all are with us. Next slide. Okay, so a little bit about our consortium. We are funded by multiple federal partners, as you can see there. And then there are also multiple technical assistance providers, and we all work together as a team to provide training and technical assistance to you around all matters dealing with domestic violence, sexual violence, and housing. And you can reach us on our website, Safe Housing Partnerships, and through multiple different means. And we are always happy and excited to help in whatever needs you may have around housing and violence. Next slide. Before we start any of these series, we really like to center the fact that well, everything in our country is racialized, and we recognize that communities of color, Black and Brown communities, experience homelessness at much higher rates due to systemic racism that founded our country. This is the time to say these things, and I'm saying them. So these are just some statistics around that, and we also want to recognize that right now is a very difficult time for communities of color, for Black and Brown communities, and we want to stand in solidarity with Black Lives Matter, and we push all of our allies in violence and housing work to also stand with that. And if you would like to get involved with us in the work that we're doing around centralizing racial justice work, please also reach out. Next slide. And also, since these are COVID-19 specific calls, we also know that the disease is hitting Black and Brown communities in very real and difficult and devastating ways. And we know a lot of that can connect directly to housing needs. So these are just some statistics, and we have one more slide of statistics. Thank you, Jen. So we know that racial residential segregation is a real impact for COVID. We know communities of color disproportionately live in neighborhoods that are further from grocery stores, medical facilities, all of those pieces. And we also know that being a person of color could be a deterrent for someone seeking help around the disease for themselves, for their families, for their loved ones. Next slide. We wanted to briefly talk a little bit about the specific housing need of sexual assault survivors in this conversation, because this is actually the first conversation we've had that's unique to sexual violence. Next slide. We know that sexual violence survivors, we know that people experience sexual violence in domestic violence relationships, and that is a real and true need for a lot of survivors. But we also know that, and I guess I put these in different orders. We also know that being homeless or having housing inequity or housing instability, excuse me, is a huge risk factor for sexual violence in people's lives. We know that children who live in a home where they're experiencing sexual violence are much more likely to run away. We also know that LGBTQ children are often kicked out of their homes for their sexual orientation or gender identity, and we know that that is a risk for sexual violence. We know that trauma has very real, long-lasting impacts on survivors that can lead to housing instability or homelessness. Folks who live on campus where that is their home and they experience sexual violence may have nowhere else to go. Folks involved in trafficking may be linked to their trafficker in a sexually abusive situation and have nowhere else to go. And the list, friends, goes on and on, unfortunately. But we really want to kind of lift those situations up and talk about how we can help those survivors. Next slide. So some specific housing need of sexual violence survivors. We know that about a fourth of sexual assaults occur in the home. So the home can feel like an unsafe place, and it can be an unsafe place for survivors, even if they are not living with the person who perpetrated against them. Or it may not have happened, the assault may not have happened in the home, and they just don't feel comfortable in that space anymore after experiencing assault or assaults. Survivors may need a place to stay to process what to do next. They may want to go to for a forensic rape exam at the hospital and not want to return home. They may live with roommates. They don't want to talk about what happened with. They may not want to talk to their parents, dealing with the police, all of those pieces that survivors may choose to do, or even grapple with thinking through. They may just want a safe place to process that, and home may not be that place. Sexual assault or harassment by landlords is a very real issue and highly underreported. And right now during COVID-19, a lot of people are experiencing issues with landlords that we're really, unfortunately, not talking about extensively. And then finally, survivors might be experiencing trauma responses that dramatically impact their lives. So that may not be directly related to housing, but they may not be able to continue in their current line of work just due to trauma and needing some time to process things. They may feel unsafe in a certain environment with different people. Again, as I said, the list goes on and on. So I just wanted to share that brief introduction really to sort of center our conversation around sexual violence and housing needs. Next slide. So as I shared, these are our presenters today, and I will let them do a little brief introduction when they answer their first question about who they are and how they got involved in this work. But I want to thank all three of you for being here and sharing your voices and your thoughts with us. Next slide. And here are some, oh, go ahead. Here are some resources from each, both Safe Housing Partnerships and all of the other member programs in the consortium around COVID-19. Okay, so we're going to start with our sort of Q&A with our wonderful presenters. So I'm going to start with Kat Fribley from the Resource Sharing Project at the Iowa Coalition Against Sexual Assault. Kat, can you talk a little bit about the link between sexual violence and housing and how they're related?
I would love to. Thank you, Carla. Thanks to everybody for being here. Thank you especially to the folks at the Consortium and Safe Housing Partnerships for making this happen. I think this is a conversation and a journey that we have all been on together, thinking deeply about sexual violence and housing and the intersections for quite a while. And I'm excited to have the opportunity to be a part of this conversation today. And Carla, as you said, I want to introduce myself just really briefly. Kat Fribley, I'm the director of the Resource Sharing Project for the Iowa Coalition Against Sexual Assault. And I've been working on issues around support for survivors of sexual violence for the last 25 years. And I'm excited to have been working in collaboration both with NSVRC and through them the Safe Housing Partnership and the Consortium, as well as with NNEDV's T-Housing Project to lift up the specific needs of sexual violence survivors over the course of the last 7 or so years. Today, I know I wanted to add to some of Carla's really important framing and to just talk about the ways that we're hoping to center our conversation today around sexual violence outside of the context of domestic violence or intimate partner sexual violence. I know that there is a lot to be done to meet the needs of survivors of sexual violence within the context of domestic violence within housing and residential-based settings. And we also know that there's a real value in being able to focus on the needs of those survivors outside of a DV context, which programs have pretty traditionally told us that they struggle a little bit more to incorporate into their housing-based advocacy and housing responses. So I just wanted to give a little bit of framing around that. And then I also really wanted to share that on our conversation today, we're really thinking about the broadest needs of survivors of sexual violence. We're not thinking about this tied to any specific funding stream or policy or a way of approaching the housing work. We know that you all come from lots of different perspectives, whether that is from advocacy programs that provide housing, whether it's from housing programs that provide advocacy. And we want to make sure that as we're talking about all of this, that we're really thinking about it from the most abundant place possible, which is really the core of this, which is how we acknowledge both the housing needs due to sexual violence and sexual violence due to housing needs, because those two are sort of inextricably linked, I think, when we think about this or talk about it. So Carla, when you asked me about the sort of, talk a little bit about sexual violence and housing, how are they related? I think that I want to make sure first to just pull that out, that there are ways in which this is really crucial that we identify that folks have needs around housing due to sexual violence, and that folks experience sexual violence due to homelessness, housing instability, and other forms of housing insecurity. So I just want to make sure that we're naming both of those things. And that when we're talking about this, we're really talking about not only immediate crisis, sexual violence that has happened right now, but that we're also talking about the ways that sexual violence and trauma over the lifetime can contribute to and or cause a need for housing, or cause homelessness or housing insecurity. So clearly this is some foundational information, and I want to make sure that I'm also pairing it, right, with the context, this current context of the racial disparities that we're seeing in COVID-19, in this really important and painfully necessary moment where we are seeing an uprising in our country, talking very specifically about the ways that structural inequities and institutional racism have also played a deep part in sexual violence and in homelessness and housing insecurity. So I want to lift up and say that we're seeing the stark realities of this even more clearly, that survivors need housing solutions more now than ever, and that survivors most impacted by COVID, those who are already marginalized and are facing the most structural inequity and institutional racism, are the folks that we want to center in this conversation, and that we really want to make sure that we are thinking about the needs and solutions from that perspective. I think one of the things that I just want to say about sort of housing and sexual violence is that survivors need a safe place to heal, right? Housing advocacy can be a really powerful tool for survivors of sexual violence to be able to create spaces of safety, of healing, of comfort. As Carla had mentioned, there are so many different ways that people come into a need for housing. And I think that as we're thinking about and talking about sort of I think you said 25%, Carla. I've heard statistics anywhere up to 50% of sexual assaults that happen where the victim lives, whether that is their current home, whether that is on campus, whether that is in a work-based residential setting, that hugely affects the feeling of safety, the feeling of ability to heal, the feeling of ability to even, the ability to even take next steps in terms of, as you said, consideration around reporting and many other things. When we think about where sexual violence that happens, where victims live, where survivors are, certainly I know that one of the things that you mentioned, Carla, was a list of many different places in terms of landlords. I also want to lift up maintenance and other housing employees, right, who are working in those situations. I want to lift up the ways that roommates, other tenants, and then folks who are in settings that are residential overall, whether that is incarceration, whether that is campus-based, whether that is medical or other institutional settings that folks are in, that in all of those, we're talking about people experiencing sexual violence within the context of their living, within the context of their home. And so as we think about sort of sexual violence and housing, I wanted to just make sure to lift up the ways in which COVID is making clearer the types of sexual violence that have been happening all along. It's intensifying sort of the circumstances that landlords and property managers rely on for victimization, right? And for violence that they perpetrate. And the fact that we are hearing more right now about folks who are experiencing sexual violence at the hands of property owners, property managers, and landlords, to me, really just, again, very clearly draws for us this picture of sexual violence that has been happening all along, that relies on structural inequities oftentimes. Because one of the very clear issues that I think we will talk about more are the ways in which it's our job to help then interrupt in those places where folks don't feel like they have other living options, right? Other options for housing. And that's exactly what we're talking about in terms of advocacy and housing support for survivors of sexual violence. So I guess I want to just pause there, Carla, because I think I just answered a lot or said a lot of things. And I'm wondering if Rebecca has pieces that she wants to add to that, or if you do, Carla.
Rebecca, do you have anything you want to add? That was
Kat,
great, Kat.
I thought that was a really great introduction to this issue of kind of what are the unique needs of sexual violence survivors in the housing context outside of looking at intimate partner violence. And I know I was going to talk a little bit about kind of what's the relationship between housing insecurity and homelessness and how that impacts survivors of sexual violence. And I think you've done an excellent job at really lifting up the fact that I think some things that we don't always think about when we're providing services to folks who've experienced sexual violence, which is basically that sexual violence can happen anytime, anywhere, and anyone can choose to harm someone sexually, and that those harms that people have experienced wherever, whenever, and by whomever last a lifetime and can impact housing immediately, but can impact housing, so child sexual abuse can impact someone when they're 35 and their ability to maintain their housing and their job. And I think I also really appreciate that you lifted up, it can happen anywhere. So it can happen, for folks who may be living in the streets, sexual violence can occur there. But if someone has been incarcerated, if someone is living in a homeless shelter, if someone is living in a home that they rent, if someone is doubled up, sexual violence can occur in that space. And then that anyone can really perpetrate sexual violence. I really also appreciate that you lifted up the fact that sexual violence and its housing impacts are crisis for survivors, and that this really deserves prioritization no matter when the sexual violence occurred or who perpetrated it. I think oftentimes we want to focus on prioritizing in our housing assessments, especially for folks who are funded by HUD. In our housing assessments, we're looking to prioritize folks who have dealt with imminent, recent physical danger. But when we talk about the needs of sexual violence survivors, oftentimes the crisis they're experiencing may be emotional, it may be economic, and that those crises and those experiences deserve the same prioritization and deserve the same access to housing as someone who may be dealing with imminent physical danger. And then you really also started your conversation out, Kat, by saying that sexual violence can create conditions in which housing instability and homelessness occur. You also said that housing instability and homelessness can create conditions in which sexual violence can occur. And this really gets at that issue of, if you're a homeless system, or if you're working within the homelessness system, or if you are a victim service provider, how do we really, however someone presents, if they present as someone dealing with housing and homelessness, or if they present as someone dealing with sexual violence, how do we not shift them from system to system and say, oh, well, I'm a homeless, I work in the local homeless shelter. You're dealing with sexual violence. I can't help you, go to victim services. Or like what, on the other hand, victim services oftentimes will have space and housing, but if someone presents as someone whose major issue is homelessness or housing instability, they'll say, well, you're not a victim. I can't help you, go to this other system. So how do we recognize that folks dealing with either of these issues, oftentimes when we dig underneath, when we're talking about people who've experienced sexual violence, there's going to be economic and housing issues. And when we're talking about people who are dealing with housing instability and homelessness, that oftentimes there is sexual violence that has occurred anytime, anywhere, and has been perpetrated by someone other than an intimate partner, including landlords, maintenance folks. And so, yeah, I just wanted to echo what Kat had said and kind of put it in the context of, for folks who are, working within different housing models, to begin to think about how we need to begin to recognize these unique needs so that we can respond differently to those survivors.
Excellent. Thank you, Rebecca. I want to ask both of you, how have you seen, or what have you seen that has changed or stayed the same for survivors of sexual violence around housing and homelessness issues during COVID-19?
This is Kat, and as I think I sort of referred to earlier, I feel like COVID just lifts up and makes so clear the types of sexual violence that have been happening all along, right? Within, especially within housing systems, within situations where folks are negotiating for rent, especially issues right now. We know that there are so many people who have lost their jobs or who are hugely economically impacted. And we know that, again, that isn't happening equally across the board. We know that that's happening really specifically in low-income communities and in communities that are Black and Brown who are experiencing COVID at very different rates. And so I just want to lift up the fact that the kinds of things that we're hearing about, especially right now, about landlords who are using violence and or intimidation or coercion around requiring sex rather than rent, or threatening to evict folks in the middle of all of this. Certainly those are the kinds of things that we've been hearing about for a long time, and they are again being more clearly seen and lifted up just in this moment, as so many things are being stripped bare, right, and sort of peeled back those layers. I'm really curious to hear from the folks who are joining us, all of you, are these the kinds of things that you've been working with survivors on, or that you've heard of, especially during this time of COVID-19? I remember thinking back, you all, maybe, gosh, I'm trying to think, I started doing this work back in 1994. So 25 years ago, about one of the first survivors that I worked with in the program that I was doing advocacy with, which was a domestic violence and sexual assault dual program, was a survivor who had been routinely harassed by her landlord, the property owner, and who was struggling to think about whether there was a possibility to report that and maintain their housing, and recognizing just the challenge of that. So I think about the fact that 25 years ago, I was working with someone who was experiencing that. And we've seen that, of course, continue, because anytime that there is a power imbalance, anytime that there is a place of power imbalance, there is, I think, a deeper possibility of sexual violence that happens. So I just want to say, I feel like more than something new, that COVID has simply made us more aware, I think, as a society, of what's happening. And I'm curious if other folks have seen sorts of similar things. And Rebecca, if you want to speak to that too, obviously.
Yeah, I mean, I think COVID has really showed how oppressions, heighten risk and compound barriers that sexual violence victims are seeing. So if you are a child or a youth or an adult experiencing sexual violence where you are, and there's a stay-at-home order that is supposedly, created to protect the most vulnerable from the spread of COVID, but then you have nowhere to go, or if you're an essential worker who happens to be undocumented and you don't have work papers within the United States. And you're experiencing sexual violence at work, in a lot of places in the country, you don't have access to a stimulus payment that might allow for flexibility to leave work or to have enough money to keep your housing if you left because of the sexual violence. So I see it's basically, providing another kind of tool that folks who choose to cause sexual harm are using to kind of entrap folks. But I would also say, on the flip side, COVID has shown that communities of people who've never been able to depend on the state or depend on a lot of helping systems are also figuring out ways to mutually assist and support one another outside of those systems. And I think there's a lot that our housing systems and our victim services systems can learn from those communities, how they're adapting, how they're supporting one another, how they're really creating community beyond services when a lot of the remedies that are available to some folks were never going to be available to them, have never been available. So COVID has lifted up that other side of kind of oppression, which is spaces in which people innovate and depend on one another and come up with solutions when their rights aren't being recognized, and when they don't have when they're intentionally denied access to resources.
I love the both and of that, Rebecca. This is Kat, that you were just saying, like, while it has lifted up the incredible disparities in the ways that oppression continues to impact, right? It also, those places of mutual aid have been some place for us to learn from, for sure. And it makes me think about, some of the things that I've seen around housing folks in hotels. I know you all have been doing deep work around finding alternate places of emergency sorts of housing. And it makes me think about the fact that homeless people who've been sexually assaulted, they often lack access to so many different services, to legal, medical, mental health services, to they facing these incredible barriers to service overall, and certainly to healing. And so it just makes me think about all of the different ways that the current moment is teaching us new approaches, right? That may very well then be applicable moving forward when we're thinking about survivors for whom perhaps our housing as it stands isn't the best solution, but how do we then help them meet their housing need no matter? I love the sort of resilience and creativity that has also come out of this moment that you were just lifting up, Rebecca.
Absolutely. Absolutely. That was a great conversation. Thank you both for sharing. It feels like COVID is bringing out the reality of so much of how we live in this country and the true struggles that people are experiencing. We do want to share, we haven't gotten a whole lot of questions for a Q&A session, which is totally fine, but I wanted to offer the opportunity for folks to share in the chat. If you want to share any experiences or challenges that you've had professionally, personally, around sexual violence, housing, homelessness during the pandemic. If that would be helpful to anybody to share, to sort of talk through. And I think one more thing that we haven't talked a lot about, which is survival sex for folks, which is clearly sexual violence as well, where people are trading sex for a place to stay, to sleep, to be safe. And we know that issue has been huge during COVID, where people had places to stay, whether or not they were engaging in survival sex there, and then have been asked to leave when people sort of were staying at home. And this wasn't technically this person's home. So that's another area where we've seen folks deal with violence and homelessness in unique ways. I want to talk a little bit about services. Either Kat or Rebecca, whoever would want to go first, can we talk a little bit about the services you know that aren't being provided at sexual assault programs that survivors are needing around housing.
Rebecca, I'm going to
That-
ask you to start us off, unless you want me to.
No,
We
I'm
both
happy
said the
to.
other's
I
name.
had put together some ideas again, and I know we're coming close to the time when Condencia is going to share about her work. So I also want to be really cognizant of not invading that space. So I think there's really two issues here when we talk about the housing and services needs of sexual violence survivors. One is access. So sexual violence survivors need access to your housing or to your housing subsidy. So you've got to be willing to work with folks who've experienced sexual violence anytime, anywhere, and that's been perpetrated by anyone, right? So whether that is, they've been forced to trade sex and they chose, not to, and they lost their housing, whatever their circumstance of sexual violence is, to recognize that that's an instance of sexual violence that has impacted their housing, and that person needs to be eligible for your housing. I mean, that's the big piece, right? Because I think we oftentimes focus on the services and we forget that if people can't even get into our housing or into our services, if they're not eligible for it, then we're stuck, right? They're not getting in. And so this, so these are some questions you might take back for the folks who participate in COCs and are participating in coordinated entry. Like, how are your housing assessments asking about about sexual violence? What happens when sexual violence is asked about? Like, how does the continuum of care respond to that? How are dual sexual and domestic violence programs or rape crisis centers involved in the process of coordinated entry and sitting at the COC table? How is kind of sexual violence prioritized when the COC decides what, and I'm going to use HUD speak right now, I really personally don't like this word, the subpopulation word, but when they talk about kind of subpopulations or groups of folks within the population of people experiencing homelessness, are people who've experienced sexual violence, are they a priority in your COC? And I know a lot of work's been done around lifting up the needs of domestic violence victims in those policy decisions. But what about sexual violence survivors outside the context of intimate partners? So that's one piece, is like eligibility, thinking about how they get in. The second piece is really services. So, and I've got about two, and Carla, if you can let me know when Condencia comes, and I can just wrap it up. I know I've got about 2 more minutes. Thank you so much. So we've got that first prong, which is access, right? So sexual violence survivors accessing your housing, accessing your services, accessing your subsidy. And then there's the aspect of services or support services in the housing world. If you're on the call and you're a dual domestic, if you're on the call and you're a victim service provider, you understand support services really to mean advocacy, right? Like, so how do you get, once someone has got, in the case of housing met, how do we support their needs? In the housing world, that for folks who aren't from the housing world on this call, support services is really that advocacy piece. So the first thing we need in support services, so they make sense for sexual violence survivors, is actively anti-oppressive, culturally relevant services. This always gets left to the end of what people need in services, and it should be the first thing, because if your program isn't thinking about the many oppressions people are facing, and if it's not culturally relevant, or if you're a mainstream program and you're not collaborating with culturally specific services, sharing resources with culturally specific services, taking the lead from culturally specific services in terms of how to do housing or how to do services, then it's a time to kind of stop and think. And RSP's got a really great resource called Anti-Racism is Fundamental to Sexual Assault Services. You can Google that. We can drop that in the chat. It's a really great place to begin to think about how in our services, this is also a housing access piece, when we're being actively anti-oppressive, when we're recognizing that the sexual violence that people experience isn't the only type of violence that is preventing their healing, that's putting them in danger. If they're dealing with the violence of racism, if they're dealing with the violence of ableism, if they have a disability, if they're dealing with the violence of homophobia, if they're dealing with the violence of ageism, All of those need to be taken into account when we think about how to support people. Otherwise, we're going to support this paper doll in our mind that we've put together of a person, and that's not actually who's coming through the door. That's not actually what people are needing. Community beyond services, I said this, our services are only 24 hours a day a lot of times, or sometimes they're only, 8 hours. What happens when the housing subsidy ends and people continue to need community? What happens when it's 2 a.m. and people need community? How do you connect survivors to one another? How do you connect people back to their communities? For people who have left their communities, for people who've lost their community, how do we support them in creating new community beyond this kind of transactional, this is a service for a report, but really seeing community creation as essential to maintaining housing and as essential to safety and healing. Voluntary services, trauma-informed services, really big piece of this. People may come in, I'm gonna wrap up in like 2 seconds because my colleague Condencia is on the line. Voluntary services, people may just need your housing subsidy. They may not need the whole list of other things that you do. Don't force them to do that. Just give them the housing subsidy. Trauma-informed, the last thing I want to say about this is a lot of times we think about being trauma-informed to deal with other people's trauma, but we're not talking about our agencies, the trauma that the organizations we work within are experiencing and have experienced. How we can traumatize one another in our work because of the traumas we've experienced, how we traumatize the people we've worked with when our organization isn't working with its own issues of trauma. And so the Resource Sharing Project and the Sexual Assault Demonstration Initiative also has some great resources around, building communities of care, looking at trauma within your agency. And with that, I will hand it back to the moderators. Thank you so much for the opportunity.
Thank you, Rebecca. That was fascinating and wonderful, and something to really think about. I should have mentioned, we are recording this presentation, and we will post a link to the resources. My apologies for not saying that sooner. So Condencia Braid from the National Organizations of Sisters of Color Ending Sexual Violence is our next presenter, and she's going to talk a little bit about a grant where she was able to do focus groups with communities of color around sexual assault and housing. Welcome, Condencia. And I just wanted to share, you should be able to unmute yourself. I know Jenny is being supported as our technical assistance help. I wanted to share a little bit, I know folks were asking for the resources around the Sexual Assault Demonstration Initiative and creating anti-racist organizations. I see Elizabeth did that, so that is in the chat, and then we will be following up with an email after this call with all of those resources, so you will have them in other areas. Are things set up? Condencia, can you share? Oh, we're giving her a number to call in. So, Kat, since we have you and we have a little bit of time, would you talk a little bit about the Sexual Assault Demonstration Initiative and sort of why all of these wonderful resources came out of this project?
Yeah, happily so. So the Sexual Assault Demonstration Initiative was a project that was funded through the Office on Violence Against Women, and a number of us on this call worked together on it. And it was really an opportunity for 6 demonstration sites to help inform a larger conversation about how we elevate sexual assault services within dual and multi-service settings, how we think about organizational capacity, community awareness and knowledge about who we are, the services that we provide, and the core sort of philosophy and grounding that allows sexual assault survivors to feel welcomed into our spaces, our services, and that makes sure that folks who maybe traditionally have not had the same level of access, especially folks who are, again, survivors of sexual violence outside of the context of domestic violence, and especially adolescent survivors, male survivors, survivors from immigrant communities, refugee communities, migrant survivors, all of the sorts of folks who perhaps haven't felt traditionally welcomed in to our organizations and our services. So the demonstration initiative was an opportunity to work very specifically with 6 sites across the country and to learn from them as they built solutions that were focused very specifically on the unique needs of their own communities. And a lot of the resources that you're talking about, there are, I know Rebecca, you mentioned the anti-racism is fundamental to sexual assault services. We also have a number of like what I think of as pretty fantastic opportunities to do ways of assessing your readiness around providing these kinds of services. And we're excited to be able to share those. Condencia, I think you're here now. No? We can't hear you, friend. You may need to *6. I know sometimes that solution works when old school mute buttons don't. Weirdly, it seems like *6 is the universal unmuting. Jenny, I wonder, is there a way that we can unmute one participant ourselves?
I think Jenny needs the number.
I think.
Okay.
It's an 860 number, and sorry for this technical moment, friends. While we figure out how to get Condencia's voice into this conversation, we're working on that.
I was just going to say, I did see a question that we could start by addressing so that we can go to the end of the call. Someone was asking about children who are in homes right now, abusive homes, being sexually abused. What are some solutions? What can we do? Which is quite a loaded question, and I think we all feel that heavily in our hearts. But I don't know if Kat or Rebecca, if you have any thoughts on that?
Yeah, I think there's all kinds of things that we've been having conversations about, right, Carla, in terms of how best to support survivors of childhood sexual abuse, especially in this moment of stay-at-home orders or shelter in place or safer at home, and then the ways that we believe that once those restrictions are lifted, that we might begin to hear more from folks, more disclosures about responding to the needs of survivors. And I think, one of the key things that I'll say here that is true overarchingly is looking at what services are available from your own agency, what services are available in your community. If you are not the one who's providing services around sexual violence, who is providing services, to ask how you can show up in those spaces, talking to your state sexual assault coalition or dual coalition about what kinds of resources are available for responding to the needs of survivors of child sexual abuse in this moment, I think are all good first steps that we can share here.
Excellent. Thank you.
Thanks, Kat. Can you hear me?
Yay!
Yay!
Hi, friend. Yes, we can.
Hi, I'm so sorry about that. For some reason, of course, when technology is supposed to work, it just doesn't. So I'm so sorry about that, and I really appreciate you all being so intentional in trying to make sure that I can participate. So I really appreciate that.
Okay, welcome, Condencia. We're so happy that you are here. Would you be willing to share a little bit about your focus groups with communities of color around sexual violence and housing?
Yes, absolutely, absolutely. I want to try and make sure that I'm not echoing. Do you all hear an echo?
No, you're good.
Okay, good. I have so many things open trying to log on that I think I've created like surround sound right here. But thank you all again, and I'm so glad we're having this conversation. It's so very timely, so very appropriate, and so I'm glad that I'm able to participate. So my name is Condencia, and I'm with Sisters of Color Ending Sexual Assault, and we have been working on the interconnection between housing and homelessness, and looking at women of color who are sexual assault survivors and their needs as they relate to housing. And so this has been, an ongoing work for our agency. And recently we were able to get some funding to begin to do listening sessions, which, we were really thrilled to be able to do it and realize, kind of like midway through, there was so much really great information, and then also so much of a need to continue to do this kind of comprehensive assessment of what's happening. I think one of the things that was clear is that, and I've heard from so many folks was, when it comes to looking at housing needs, and particularly when you're talking about communities of color, there are some, preconceived notions and preconceived biases sometimes as to why there are housing needs. And so I think that sometimes that can overlay, when women of color are trying to access housing. So, that was something that we heard, a lot. And so I really think it's something that we kind of have to like unpack and look a lot at. So what we did, I know that we are short in time, and so I'll tell you, we really tried to crisscross the country. We held listening sessions with impacted women of color. We had conversations with advocates that were working on sexual assault, women of color advocates that were working in sexual assault, as well as people of color advocates that were working in housing. And so really trying to have a cross-section of folks that we were engaging with that looked at housing, either folks that were impacted themselves or folks that were working to respond. And so, got a lot of really rich information. I of course, cannot even go through all of it. I think I want to pick out some things. It was clear, the folks talked about seeing, there were a lot of Black and Latino women that were showing up for services. Also a lot of urban Native women that were needing services. Oftentimes when it came to urban Native women, there were a lot of challenges in terms of getting services at local programs. Some of the women that we spoke with talked about Native women that were coming off, that had lived on reservations and now were trying to adjust to, life in the urban neighborhood without adequate support, and often these women ending up in homeless programs and having a higher vulnerability to sexual assault. Also, this issue of language access and concerns of immigration status, making it harder for many Asian and Latinx women to access programs. This idea of this sense of anti-Blackness, that sometimes housing programs don't want to work with Black and brown women, and those women feeling that, and oftentimes by the time they get to showing up and needing support around housing, they have this is like their absolute last resort, because they so much don't even want to show up there. They talked about, trans women of color often preferring to go to their friends, even though their friends may not be safe, instead of a homeless program, because, and I think one person we talked to said it so well. She said, for trans women, their treatment is so wrong. I thought that was so, insightful. They talked about youths and youth coming from families where there was a history of incest, and they talked about, even in the context of sometimes when there's information about youth, it talks about youth broadly, and that when they're talking about youth, they talk about youth broadly, number one. And then when they're talking about youth, they may talk about LGBT youth, but then there's often LGBT youths of color are often missed in that, and so that being an issue. They talked about lots of youth who are quote unquote on the street because they came out of the foster care system. Either they left because it was unsafe, or because they aged out of the foster care system, and that being an issue. And often, these youths are trying to survive with many underlining trauma, and often being survivors of sexual assault. And so, the idea that many survivors had multiple incidents of sexual assault, and that most times women of color are coming in with, compacted mental health and trauma issues, and having experienced sexual assault for a number of years in a number of ways, and not having gotten any interventions before that happens. And the idea that, unfortunately, many housing programs do not come from a trauma-informed context, and are, oftentimes, can be in this place of trying to just move folks along and housing them for, a short amount of time and then moving them. And then the idea of the rapid rehousing there's some pluses to that, but some of the unintended consequences is this quick to move doesn't allow for there to be some comprehensive response to the survivors, sexual assault survivors, women of color, sexual assault survivors that are showing up. Talking about this need to address the survivors, women of color survivors as a whole person, and that wanting, survivors, impacted women talked a lot about that they wanting to be seen and treated as a whole person, and also wanting to be seen and treated as a respectful person. That, I think, one survivor in one of the sessions that we had, one survivor said this, and it was echoed so many times, that safety for sexual assault survivors is about options, that I'm coming to you to seek resources and help, and I'd like to have options and be able to choose what options work best for me. And so that was something that folks talked about. Also, another thing that was lifted up is that sometimes sexual assault survivors just want to be able to get out for a short time and have no place to go. I think one person that we interviewed talked about that sending a sexual assault survivor to a DV shelter feels disingenuous, and it feels like, quote unquote, a slap in the face, and you don't see me. And so that was something that, and we asked some of the other folks that we talked to, what do you think about that? And, folks oftentimes said that, that felt like a pretty good, that was a pretty good comment to reflect what they were seeing themselves. I think is this, again, there's just so much that I could go on and on. I will, I'll stop there because I know in terms of time, just to kind of share. I mean, like I said, this is something we hope to continue to, we got some really rich information, and we are wanting to continue. We're continuing to gather information and talk to folks. There is, housing and housing needs and communities of color is complex. And then when you're layering on communities of color who are survivors of sexual assault, it's even more complex. And I think, one of the things that we're hearing so many times is that there's this idea that if you only see, I think one of the quotes that we said is that, because the housing needs are so much more than just poverty, when you marginalize all communities of color to housing because of poverty, you're not clearly seeing our real needs. And so that was something that came up a lot. The last thing I'll say in that is that, there are culturally specific communities of color organizations that are across the country addressing sexual assault. We need many, many more of them, but there are those that do exist, and they're by and for their community and grounded in their community. They're where many women of color go when they need support and they need services. oftentimes these culture-specific communities of color organizations are not a part of the continuum of care. They're not able to sit at the table. They're not able to bring the needs of their communities to the table, and that's really a challenge, and really is an unintended consequences when we're trying to that can be very harmful when we're trying to respond to women of color survivors of sexual assault and their housing needs. So wanted to mention that. Carla, I know I kind of went really fast, but I don't, if folks have questions, happy to answer them. I heard some of the folks that, what folks are talking about in terms of COVID and what was happening there, how right now the pandemic has impacted for, women of color and survivors of color who are sexual assault survivors. And I mean, so much of what you said rings through. I think what we know or seeing is that, really the pandemic has really kind of, as folks have said in other ways, kind of ripped the Band-Aid off of these things that we have tried to fix with short-term solutions that really need comprehensive responses. And we are seeing the increased vulnerability and trauma that is impacting for survivors of color in the pandemic, and the heightened the heightened vulnerability to sexual assault as well. I think one of our programs I was talking to was just, saying that a comment that she heard from a survivor of color was that feeling the sense of that they're trapped in their, as a sexual assault survivor, they're feeling trapped in their minds and their body right now. And, in the pandemic and the needs for social distancing, there's an isolation that makes them feel even more trapped now, because now they're trapped in their home as well. And so, I think, really being intentional about thinking about, what does that mean and what kind of support and services we can provide survivors in that context. So I said I would stop talking, and I continued. So I really am going to stop now.
No worries. We love hearing you talk, and thank you so much for sharing all of that. Does anybody have, I don't think we have any questions. I wanted to let folks know that we do have a survey just to sort of find out what folks need around COVID, what do survivors or your staff need around COVID. There's a short survey if you'd like to fill that out. We do these every week and try to get experts to share with you on different topics. So please share more. Do any of the panelists have any final thoughts before we wrap up for today?
This is Kat. My hope is that this is the beginning of a conversation, and that while this conversation was within the context of COVID, that so much of what Condencia was sharing, so much of what I know Rebecca and I were hoping to, have conversations about overall, that all of that feels like the beginning of a conversation with programs who are seeking to provide housing and housing advocacy to survivors of sexual violence. So yeah, just hoping that folks get in touch if there are additional things that any of us can provide or answer, and then also that this might be the launching of a larger opportunity to be in community around this.
Excellent. Anyone else? Rebecca, Condencia? Okay. Well,
I think I want to echo just what Kat said in terms of, this being, a beginning conversation, and that the opportunity for us to continue to engage and, really be intentional about addressing these issues and making sure that survivors of sexual assault have access to the housing needs that come up for them. So I think, absolutely echo this idea of that we need to continue to look at this, and this is beginning and not necessarily, just the one-time conversation. So yeah, definitely echo that.
Thank you. And this is Carla. I just wanted to say thank you, everyone, all of our speakers, but I also want to echo what Kat and Condencia said. As people that have worked in the sexual violence movement for many, many years, we have known that this is an issue for survivors of sexual assault, and we have known that our service providers really struggle to meet this need. And there are many different reasons for that, but we just aren't able to offer to survivors what they need. And so this is something that we have been dedicated to addressing for a long, long time. So we just wanted to thank everyone sort of for showing up and listening. And we do ask for your commitment to continue the conversation because we want to be able to serve survivors holistically. So I think that's it. Thank you all so much and have a safe rest of your day.